Well, Brad, as you know, Kansas City encompasses 3 counties, and within those counties there are rural, suburban, and urban areas. And all that variety creates some challenges, both logistically and with messaging. The purpose of the task force is to prepare for more vaccine coming our way by creating a system that is efficient, equitable, and transparent. But some new statewide data suggests the equity portion is lacking. Truman Medical Center and University Health just started a program that's taking vaccinations on the road. The first stop was yesterday at Morning Star Missionary Baptist Church at 27th and Prospect, an effort to get the vaccine to those with limited access, including seniors in the current rollout.
We know the people that live in the zip codes that have been disproportionately affected by this disease, and we came out to reach them.
Tuesday, the state started a dashboard on vaccination progress. Here's how things look locally by county. This is percentage of county population who've had at least 1 dose. You'll see Clay, Jackson, and Platte are about even, hovering close to 4%. But look at the breakdown between race and ethnicity, and participation is far from equal. Statewide, 3.7% of white people have been vaccinated, but only 1.5% of black people have. And for Latinos, it's less than 1%.
Whether there's transportation barriers, whether it's you can't take off from work.
Melissa Robinson is the council member who proposed the task force, but she also directs the Black Healthcare Coalition.
A lot of African Americans do not have, for good reason, deep, trusted relationships with the medical community.
They've been hosting Facebook Live forums with doctors and clergy called Is the Science Safe? To address concerns and mistrust.
In medicine, we look at risk-benefit ratio.
She's now working with pastors at 20 churches, including the one where yesterday's clinic was held, to bring the message to parishioners. But she wants to be clear, the city task force is not just about communities of color. It's about finding approaches that fit a diverse city population and getting specifics set up early, so when the state starts sending vials in larger numbers, the city can get clinics rolling right away.
When we talk about equity, we're talking about ensuring that we're getting the vaccine to those who need it most, while also having a plan for every resident.
Now, she wants to make sure that this task force is not just city officials and healthcare professionals, but she wants to make sure someone's included who's an expert in logistics and someone who's an expert in communications. That resolution for a task force passed unanimously today in committee, and it goes before the full council tomorrow. Live in Kansas City, Missouri, Betsy Webster, KCTV 5 News.